Today, Auvelity A circumflex euros, a novel. Today, Auvelity A circumflex euros, a novel Dextromethorphan-Bupropion combination for depression, how it works, and what makes it different. Depression is one of the most common psychiatric conditions, and first-line treatments do not work for everyone. Auvelity is a newer FDA-approved option with a mechanism that works differently from standard antidepressants. Understanding what it is, what it does, and what it requires is essential for anyone considering or discussing this medication. Auvelity is a fixed-dose combination tablet containing two drugs, dextromethorphan hydrobromide at 45 mg and bupropion hydrochloride at 105 mg. It is taken orally. Bupropion serves two purposes in this combination, A circumflex euros. It works as an antidepressant on its own, and it inhibits an enzyme called CYP6, which raises the level of dextromethorphan in the body so that it can reach the concentration needed to be effective. Auvelity is FDA approved for the treatment of major depressive disorder in adults. It is not approved for bipolar depression, for treatment-resistant depression as a formal indication, or for patients under 18 years of age. It has not been studied in pregnant or breastfeeding patients in adequate and well-controlled trials, so its use in those populations requires careful individual consideration and discussion with a clinician. Dextromethorphan is the component that distinguishes Auvelity from standard bupropion products. Dextromethorphan is an uncompetitive antagonist of the NMDA receptor A circumflex euros, the N-methyldiaspartate glutamate receptor A circumflex euros, and also acts as an agonist of the sigma-1 receptor. These actions on glutamate and sigma-1 signaling are thought to underlie its antidepressant effect. Bupropion is included in this combination primarily for a pharmacokinetic role. It inhibits CYP6, which raises dextromethorphan levels and enables the antidepressant effect, while bupropion also works as a norepinephrine-dopamine reuptake inhibitor A circumflex euros, a separate antidepressant action through monoamine pathways A circumflex euros. That property is incidental to its role in Auvelity's formulation. The combination creates a dual glutamatergic and monoaminergic effect that is distinct from SSRIs or SNRIs. Dextromethorphan on its own is metabolized quickly by the liver enzyme CYP6. In most people, a standard dose of over-the-counter dextromethorphan produces only a brief, low-level effect because it is cleared rapidly before meaningful brain exposure occurs A circumflex euros. This is why OTC cough syrup does not produce a psychotropic antidepressant effect. Bupropion inhibits CYP6. In the Auvelity combination, that inhibition slows dextromethorphan metabolism, raising its concentration and prolonging its activity so it can reach levels that produce an antidepressant effect. Without the bupropion component, therapeutic dextromethorphan levels would not be reliably achieved at standard doses. This pharmacokinetic synergy is what makes the combination possible, and is also why the combination is proprietary A circumflex euros. You cannot replicate this effect simply by taking OTC dextromethorphan with a bupropion product at standard doses. Like other antidepressants, Auvelity's full mechanism of action involves complex downstream effects on brain networks, not just a single receptor or pathway. The NMDA receptor antagonism and sigma-1 agonism affect glutamate signaling, neuroplasticity, and circuits involved in mood regulation. Depression resolution likely involves downstream effects on synaptic plasticity, neurogenesis, network connectivity, and monoaminergic modulation that extend beyond simple NMDA blockade. Bupropion's norepinephrine and dopamine activity modulates arousal, motivation, and reward pathways, and may synergize with glutamate modulation in ways not fully captured by a single mechanism model. Together, these actions influence multiple systems involved in depression. It is important to understand that this mechanism is a working model based on current evidence, not a complete account of how depression resolves with treatment. In clinical trials, Patients taking Auvelity showed significant improvement compared to placebo as early as week 1 in some analyses. This has generated interest in a potentially faster onset compared to traditional antidepressants, which typically require 2 to 4 weeks for initial effect. However, response varies between individuals, and the rapid onset signal was not demonstrated at every time point across trials. Patients should be counseled that improvement may begin within the first few weeks, but full benefit often develops over 6 weeks or longer, and individual response is unpredictable. Common side effects observed in clinical trials included dizziness, headache, dry mouth, nausea, constipation, somnolence, and sexual dysfunction. Sexual dysfunction is shared with serotonergic antidepressants, though it may be less frequent with Auvelity than with SSRIs in some observations. The side effect profile reflects contributions from both components, with dizziness and somnolence more attributable to dextromethorphan, and dry mouth and nausea more commonly linked to bupropion. Side effects are generally most pronounced in the first few weeks and may diminish as the body adjusts. Dizziness and headache were among the most frequently reported adverse effects in trials. Dry mouth and gastrointestinal symptoms such as nausea and constipation occurred in a meaningful proportion of patients. Somnolence or drowsiness can occur, and patients should be cautioned about operating machinery or driving until they know how the medication affects them. Sexual dysfunction, including decreased libido and difficulty with arousal or orgasm, was reported and should be discussed openly, as it is a common reason for antidepressant discontinuation. Constipation, sweating, tremor, and mild anxiety or agitation were also reported. Because bupropion can produce activating effects, some patients may experience anxiety, agitation, or insomnia, particularly early in treatment. This activation is generally dose-related and often transient. In patients with significant anxiety as a prominent feature of their depression, the activating properties of bupropion may be beneficial once tolerance develops. However, in some patients, activation and agitation can worsen anxiety symptoms, and clinicians should monitor accordingly. Palpitations or a sensation of a racing heart may also occur and should be evaluated if persistent or severe. The bupropion component carries a well-documented risk of seizures. This is one of the most important safety considerations with Auvelity. Seizure risk with bupropion is dose-dependent and is also influenced by patient factors. Bupropion is contraindicated in patients with a known seizure disorder, a history of bulimia or anorexia nervosa, and in patients undergoing abrupt discontinuation of alcohol or sedatives. This is the same contraindication profile as Wellbutrin XL and Wellbutrin SRA circumflex euros, the same drug in different delivery formulations. The seizure risk should be communicated clearly, and patients should be screened for these risk factors before initiating treatment. This is not a unique or unexpected risk for Auvelity A circumflex euros. It is the same risk profile as other bupropion-containing products. Before starting Auvelity, clinicians should screen for conditions that increase seizure risk, including prior seizure history, eating disorders, and substance withdrawal states. A careful cardiovascular history is also relevant given bupropion's blood pressure effects. Patients should be screened for bipolar disorder or manic episodes, as antidepressants can precipitate mania in susceptible individuals A circumflex euros, a risk that applies to all antidepressants but may be slightly higher with Auvelity given the activating properties of the bupropion component, similar to the concern with bupropion monotherapy, Wellbutrin. Baseline mood and suicidality assessment is recommended, especially in younger patients, given the suicidality warning associated with the bupropion component. A history of hypersensitivity to any component of the formulation is a contraindication to use. Bupropion can cause increases in blood pressure and has been associated with new or worsening hypertension in some patients. According to the Wellbutrin label, the incidence of new or worsening hypertension is approximately 1 to 2% at standard doses. Mean BP increases are small in most patients, but can be clinically meaningful in those with baseline hypertension. Blood pressure should be assessed before starting treatment and monitored during follow-up visits, particularly in patients with a baseline elevated blood pressure or cardiovascular risk. Routine serum level monitoring is not required, but clinical follow-up is essential. Dextromethorphan can, at high doses, produce dissociative or hallucinogenic effects. At prescribed doses, frank psychosis or hallucinations are not expected, but they have been reported in post-marketing experience. Patients and families should be counseled to report any unusual changes in perception, suspiciousness, or sensory experiences that were not present before starting the medication. These symptoms require prompt evaluation and may necessitate discontinuation. The risk of perceptual disturbances at standard prescribed doses is low, but not zero. Auvelity should not be used concurrently with monoamine oxidase inhibitors, or MAOIs. At least 14 days should elapse between discontinuation of an MAOI and initiation of Auvelity, and vice versa. The combination raises the risk of hypertensive crisis. Note that dextromethorphan alone has minimal serotonergic activity and would theoretically carry less MAOI interaction risk than serotonergic antidepressants. However, the 14-day rule applies to Auvelity as a whole due to the bupropion component and theoretical serotonin syndrome risk with DXM at high doses. Caution is required when combining Auvelity with other drugs that lower the seizure threshold, including some antipsychotics, tramadol, and other bupropion-containing products. Duplicate therapy with other bupropion products is contraindicated. If a patient is switching from Wellbutrin to Auvelity, the Wellbutrin dose should be reduced before the switch, or the Auvelity dose can be halved acircumflex euros. The tablet can be split acircumflex euros to manage the transition per label guidance. Dextromethorphan can interact with serotonergic drugs to produce serotonin syndrome, though at standard doses this risk is low. Since bupropion inhibits CYP-D6, co-administration with drugs that are metabolized primarily by this enzyme can increase their exposure. This is not typically a contraindication, but requires awareness. Drugs such as certain antidepressants, antipsychotics, and beta blockers may be affected. Patients should be asked about all concomitant medications, including over-the-counter drugs and supplements. Alcohol should be used cautiously or avoided, as it can lower the seizure threshold and also interacts with bupropion's central nervous system effects. Auvelity's NMDA antagonism and sigma-1 agonism are mechanisms not found in standard first-line antidepressants. Unlike SSRIs and SNRIs, which primarily target serotonin and norepinephrine reuptake, Auvelity adds a glutamatergic component through dextromethorphan. Unlike ketamine or esketamine acircumflex euros, which are NMDA antagonists administered by infusion or nasal spray in supervised settings, acircumflex euros, Auvelity is an oral tablet taken at home. While both target NMDA receptors, Auvelity's dextromethorphan is far less potent as an NMDA antagonist than ketamine or esketamine. It is not a dissociative anesthetic at standard doses, and the comparison to ketamine is mechanistic rather than equivalent in clinical depth. Clinically, Auvelity may serve as a step-down option during ketamine or esketamine tapering due to its overlapping NMDA mechanism and oral convenience, though evidence for this specific use is still emerging. Unlike bupropion alone, Auvelity adds the NMDA mechanism and is specifically approved for MDD as a combination product. It is not a replacement for or superiority claim over other antidepressants. Choice of treatment depends on individual patient factors, side effect profiles, comorbidities, and response history. Auvelity is a novel antidepressant combination with dual action on glutamate and monoamine pathways, approved for major depressive disorder in adults. Its two components acircumflex euros, dextromethorphan and bupropion acircumflex euros, work together both pharmacodynamically and pharmacokinetically. Common side effects include dizziness, headache, dry mouth, and sexual dysfunction. Serious safety considerations include seizure risk, hypertension, bipolar and suicidality screening, and MAOI interactions. It is not approved for patients under 18, and its use in pregnancy and breastfeeding requires careful individual assessment. As with any antidepressant, response is individual, and clinical follow-up is essential. This overview is for educational purposes only and does not constitute individualized medical advice. Leave a comment and like this video.